I'm Dr. Arlene Edwards-Joseph. I live in Raleigh, North Carolina, but I'm originally from Antigua and Barbuda. I have been with GCSCORED for a while. I do several things. I am one of the supervisors for practicum students and practicum and intern students. I also facilitated the peers group, and then I just do whatever else is needed.
My name is Kellan Sheldon Natu, and I'm from Mount Rose in St. Patrick's, Grenada. I am a social work student at the University of the West Indies Open Campus, but actually majoring in social work, minoring in youth development work. And I'm new to GCSCORED. I'm here to learn as much as I can so that I can be empowered and equipped with the necessary skills to tackle social issues in my community, as well as Grenada by extension. It's a pleasure to meet you all, and thanks for having me.
All right, good afternoon, everybody. My name is Edwin Felix, and I'm from Grenada. I am a guidance counselor at a high school here in Grenada, but I'm here looking forward to the experience. It's nice meeting everybody.
Good evening, everyone. My apologies for not being able to put on my camera at this time. I am Lindy Richmond Modest, and I am a guidance counselor here in Grenada and a clinical community psychologist by training. I am also trained in the room time process as well, and I am happy to be here.
My name is Gracelyn or Vilma Gracelyn Paul. I live in Grenada. I am trained in the room time process. I am a student, graduated from St. George's University with a degree in psychology, first degree in psychology. I have been with this, I have actually participated. I was our RPIC for the first online counseling session ever done, and that was with the Room Time. I facilitated students in the age of the 8-year-old students. That was an absolute blast. I've also had some training with the wellness program, and GCSCORED is an organization that I'm very much interested in, and always excited to be a part of the new and developing aspects of GCSCORED. So I am very thrilled to be a part of this evening's session. So again, my name is Gracelyn Vilma Paul. Thank you.
I am Catherine Luces. I am from Trinidad and Tobago. I am happy to be among my Grenadian counterparts, and including my Caribbean counterpart, Arlene. How are you doing? I am the GCSCORED Caribbean Director, and I've been with the organization for, I think it was from 2016 or 2017 or thereabouts, a number of years. And I'm happy to be part of, I am not sure what you said before, you'll excuse me, I was a bit late. So I think congratulations are in order in terms of the GCSCORED Eastern Caribbean incorporation. So congrats.
All right, so we're introducing GCSCORED Eastern Caribbean. We're gonna have, if you get a chance to take some notes or put some information in the chat, we would entertain questions and comments at the end, okay? So we're introducing GCSCORED Caribbean. This is who I am, founding president of GCSCORED. I'm also an associate professor of the chair at Indiana University South Bend. Kalisha, you want to introduce yourself?
Hi, I'm Kalisha. Hi, I'm Purcell Charles, the girl with 3 last names. I'm happy to be here. As I've said before, I am a psychotherapist at the St. George's University. I specialize in substance abuse disorders. I facilitate an outpatient treatment group called HOPE, helping our people exhale from their struggles with addiction. And I am been with GCSCORED since 2015 and currently the vice president of Grenada, Caribbean, Petit Martinique, and the Eastern Caribbean. Welcome.
Thank you. And then Anna Maria St. Just, she is our program coordinator and administrator. She's also a victims services coordinator. She's a certified mediator. She holds a Bachelor's of Law from London Metropolitan University, and she's been serving the underprivileged and vulnerable populations in Grenada for 14 years. She's unable to make it this evening. All right, so GCSCORED, who is GCSCORED? GCSCORED, stands for the Global Center for Systemic Change, Outcomes Research, Evaluation, and Development. And it was incorporated in the US in 2013. Then in 2015, GCSCORED Caribbean incorporated in Trinidad and Tobago. And in March of this year, 2022, GCSCORED Eastern Caribbean was incorporated here in Grenada. So again, you are attending the launch of GCSCORED Eastern Caribbean. All right, so what is our purpose? The purpose of GCSCORED and the mission, our purpose is to build relational capacity in individuals, families, organizations, and communities. What is our mission? It is to renew minds, transform lives, and create safer communities. And most of the pictures that you will see here this evening are pictures from Grenada. Okay, so these are some sea grapes from the Grand Beach. So I'm keeping it local. All right, relationship capacity cultivating. Some of our other statements of purpose and statements of why we're here, why we do what we do. Relationship capacity cultivating, I'm just expanding on our purpose, is the process of developing and strengthening the markers. Markers is an acronym for mindsets, activities, relationships, knowledge, emotions, resources, and strategies. So it helps to relationship capacity cultivating, strengthens and develops markers in individuals in their homes, their schools, workplaces, communities, organizations, and institutions. And these markers help individuals survive, thrive, adapt, and grow in a fast-changing world. And so what we do at GCSCORED is to help individuals cultivate. We expand, we help you to expand your capacity. It's like a bag that is a suitcase that is expandable. And so that's what we do. That is what we do here, one of the things we do. So GCSCORED is your choice. Why is GCSCORED your choice? Because it helps you become a conscious problem solver and an empowered life coach. So when you choose to work with GCSCORED, we help you to become a conscious problem solver and an empowered life coach. And so as you become that problem solver, you help others to become, through being a life coach, you help them to become conscious problem solvers as well. We envision individuals of all ages living their best lives in resilient settings and societies where all individuals, institutions, and communities are fully engaged and where every piece matters. So everything that you're doing, or everything that we do at GCSCORED matters. Every part of our organization, every person who initiates a relationship with GCSCORED, they matter. The moment you engage with us, one of our goals is to make sure that you know that you matter. And so we do that regardless of status in life. Okay, so our goals, what are our goals? We have two main goals that drives everything that we do. Again, these are Grenadian fruits. You can see the guavas and I think that's sapodilla. Yeah, and some governor plums, huge. Anyway, so goals, our two goals. Number one is to increase access to the destigmatized and demystified problem-solving strategy, the Rumor Time process, which is the Rumor Time process, so that individuals in diverse settings locally and globally can become conscious problem solvers. And like I said earlier, empowered life coaches as they acquire these healthy social emotional markers. Then goal number two is to educate, equip, and empower individuals to effectively utilize the Rumor Time process as they renew their minds, transform their lives, and create safer communities. So what does GCSCORED do? We engage, educate, equip, and empower. And how do we do that? We have 3 divisions. GCSCORED has 3 divisions that helps us to engage, educate, equip, and empower. And those 3 divisions are the Institute for Social Emotional Education, the Listening Oasis Wellness Space, and the Journal of Global Engagement and Transformation. And I believe many of you went on to the website and you were able to acquaint yourself with our divisions. Okay, I may go back to that slide, come back to that slide later on. So GCSCORED, as I said, engages and empowers individuals of all ages, races, beliefs, locations, and other socio-demographic factors across the globe about the CSS framework. And so the CSS framework is the Cultivating Seed System framework, and that is it's like our Bible. Okay, that is how GCSCORED does everything. It's based on the CSS framework. And again, those of you who went on the website, you will see what that is, what the CSS framework is. This evening, I'm just doing an overview, just introducing you to GCSCORED. Again, we empower individuals. We empower all individuals, but we look especially, or we work especially with people of color, indigenous peoples across the globe, right? And other invisible, marginalized, voiceless, and vulnerable communities. We're using, educating, equipping them, and empowering with the Rumor Time process. We also empower, equip, educate, engage individuals to effectively utilize the social emotional first aid as a social emotional wellness support and resource. If you went on the website, you would have seen all of this. And finally, we educate, equip, empower, educate lay persons. And that's a really important piece of what we do. You can be someone, you do not have to have a degree to get trained in the CSS framework. You do not have to have a degree to receive services from, you don't have to have a degree to receive services from us. You don't have to have a degree to provide services for us on behalf of GCSCORED. And so lay persons, ordinary people, we're looking for ordinary people as well as those who are educated. But this program, GCSCORED, does not discriminate based on educational levels. It does not discriminate on gender. It does not discriminate on religion. It does not discriminate on abilities, educational attainment, socioeconomics. No socio-demographic factor is a barrier for GCSCORED to work with individuals, okay? So we teach laypersons and others to effectively utilize the CSS framework as a reconceptualized, destigmatized, demystified, culturally responsive, task sharing, task shifting framework. As you get into working with GCSCORED, these words will make more sense to you. As we all know, mental health is a very stigmatized phenomenon across the globe, but specifically in communities of color and in the Caribbean. So I'm looking at it from a lens, almost like a funnel, starting off wide and coming down to the narrow part of a funnel. And that narrow part of the funnel is the Caribbean region, where we do a lot of work and where we're focusing on this evening because we're doing a launch of the GCSCORED Grenada Eastern Caribbean. And so these are the things that GCSCORED does: engage, educates, equips, and empowers individuals to effectively utilize the CSS framework We encourage individuals of all stratas of society to engage with us. We educate them, we equip, we empower, because everyone needs to be socially, emotionally competent. All right, so GCSCORED has its own mental health definition and understanding, right? And so we approach mental health from a social emotional wellness perspective. We believe that in order to achieve balance, triadic balance, we must intentionally and consciously focus on the roots, such as the relational capacity building that we talked about earlier, those skills. We also look at the conditions and the resources at home, in a person's school, in the work, and in the community. How do these conditions or resources support or hinder growth and development, right? So those are the ways we look at mental health. We don't look at mental health from a medical model perspective. We interpret many symptoms, and you see it says here many symptoms, not all symptoms, but many symptoms, behaviors, feelings, labels, and diagnoses as fruits or outgrowths and manifestations of the activities happening at the root level. And we talked earlier, where's the root level? The root level is the skills, the resources, and the conditions that individuals live, love, learn, earn, and play and pray in. Those are the root level issues that we look at. All right. So social emotional wellness impacts all of us. And there's a quote that I've coined that I think is perfect for what we do. As you ponder and contemplate this quote, it will give you an understanding, a broad and comprehensive understanding of the work that GCSCORED does and the work that GCSCORED wants to continue doing here in Grenada and the Eastern Caribbean. And that quote is, as air is to life, so are social emotional competencies to relationships. They are like the air we breathe. And so think about breathing, think about life. You can't have life without breath, without air. Similarly, you can't have healthy relationships without social emotional competencies that are balanced, okay? All right.
The title here says social emotional wellness impacts all. And I think that is extremely true. It's factual. And I think this is what brings us into why do we want GCSCORED to be part of Grenada? Why do we want GCSCORED to spread across the Eastern Caribbean region? Why? Because we as a nation are at such a crucial point in our development, and we lack in resources. However, we lack in social emotional skills. So when we talk about social issues, we think of things like suicide, teenage pregnancy, poverty, drug and alcohol abuse, gender-based violence, school dropout. We talk about sexual violence, underemployment, unemployment. We look at the number of students that are not coming into college and universities. We look at issues in our education system and our healthcare system, right? Now, I want us to just briefly, I know we only have a short time here, and this is just a short version to all the things that we can speak about, but our suicide rate, I know a lot of you, well, all of us have gone through a very crucial point as we dealt with COVID. COVID has destroyed us socially, emotionally, physically. It has impacted us. Our suicide rates in 2020, as we tried to cope and manage what was happening with the pandemic. Grenada recorded 6 suicides that year and four attempted suicides. Prior to COVID, within the last 5 years, we had 27 suicides that were recorded. So that's a huge issue. And with those suicides, the age group, between 50 and 35 is the dominant age group. So that's a huge issue. That is a huge issue. Now, we know that there must have been that inability to manage that led, and obviously we know it's a trauma, but the thing is, many people go through trauma, but some people they don't have the support, they don't have the skills to help them through such trauma and such difficult situations. The rate of adolescent pregnancy in the Caribbean is among the highest in the world, So that's something that is a problem for us. There have been a steady decrease in the adolescent fertility rates in Grenada from 38 per 1,000 births in 2010 to 27 per 1,000 births among women ages 15 to 19, and that's in 2019. Our poverty level is extremely high. In 2016, 38% of the people in Grenada were living in poverty. Okay, that's a huge problem. The unemployment, underemployment is an issue. We have 46% of adolescents between ages 13 and 15 that have at least started drinking alcohol, or have at least had 1 or 2 drinks based on the data within the last 30 days. 46% of adolescents aged 13 to 15, right? That's a huge issue. We know, most of us here, we live in Grenada, we know the gender-based violence is definitely, the numbers are outrageous. We have over 29% of all women would have at least experienced one form of violence. And that's what's recorded. And we know during the COVID period, a lot was not recorded, but a lot of trauma was definitely happening, and a lot of violence were happening in homes. When we look at our school dropout rates, especially among secondary schools, that is a big issue. So, the sexual violence numbers are alarming.
So this is just a brief overview of what motivated us, GCSCORED, to expand and become incorporated in Grenada, which will be serving the Eastern Caribbean, which includes, I believe, Antigua, Dominica, and many other countries in the Eastern Caribbean region. All right, so we're going to continue. Again, just keep in mind, you're going to have an opportunity to ask questions shortly here. One of our main programs is our social emotional first aid. Here's our definition for social emotional first aid. It is a 5-step culturally responsive problem-solving training course that educates, equips, engages, and empowers participants to recognize, understand, manage, express, and reflect on their thoughts, interactions, mindsets, and emotions as it relates to self, others, and life situations. We have an upcoming event of our social emotional first aid 1-day training. That's June 23rd. Again, that's virtual. So what is wellness and health? Wellness is a choice of lifestyle marked by a balance of body, mind, and spirit. And this picture here I got these rocks in Grand Riviere in Trinidad, and this log was also a part of it. And I created this balancing here to signify the balance of the body, mind, and spirit. Okay, body, mind, and spirit. So wellness is a choice. This is the definition we use for wellness and health. It is a choice of lifestyle marked by a balance of body, mind, and spirit. Social emotional wellness, what is it? It is a person's ability to recognize, understand, manage, express, and reflect on their thoughts, interactions, mindsets, and emotions as it relates to themselves, to others, and to life situations. And then as people effectively utilize these competencies and they become educated, equipped, and empowered, it transcends, like I said earlier, it transcends age barriers, it transcends life stages, it transcends location, and it helps individuals across all of these socio-demographic stages or factors to successfully navigate their daily lives as they are in relationship, as they go to school, as they work, as they build relationships, as they problem solve and adapt to the demands of life, such as growth and development, which we're always engaged in. We're always engaged in relationships. And so that is the overview that I wanted you all to get this evening. I'm going to stop sharing and find out if anyone has questions or comments. It is now 6:44, and my goal is to make sure that people are done. We are finished by 7 p.m. So I'm going to, like I said, stop sharing and see if there are any questions or comments.
I'd like to apologize. The computer just went off. But I'm sure you guys understood why where I was going in terms of GCSCORED coming in to make an impact and really educating and equipping individuals with the skills that they need to have better relationships. So I am just happy that we're here today, and we can probably have just a brief conversation about, how can GCSCORED, infiltrate, how can we really make a difference? Because I think sometimes persons come and they start with a program and they disappear, and there's no follow-up. I think that we're here ready to create sustainable work, So if anybody's willing to share, the floor is open.
Mm-hmm. And so we also want, thank you for that, Kalisha. We also want to, in addition to infiltrate, we work from the ground up, okay? We work from the ground up. And so GCSCORED Eastern Caribbean, as is GCSCORED Trinidad and Tobago, we want to include regular people. And I consider myself regular people, and I consider each of you regular people. And how can you, right, there are many opportunities with GCSCORED. You can be trained as a wellness champion. You can be trained as a rheumatoid prevention intervention coach. You can be a part of the Listening Oasis wellness space as a rheumarizee or as a wellness champion. You can participate in the Rheumatime Family Summer Camp. You can refer individuals to the Rheumatime. I mean, there are myriads of ways. We also want to start doing some work with Imani in Grenada. We want to do some work in all different sectors of Grenada, in communities. As I drove around Grenada, and I am Grenadian, just want everybody to know. I have my Grenada passport, which I'm very proud of. And I'm seeing the things, I'm seeing the gaps, I'm seeing the things that are needed so desperately in this country. And I also see the potential, I see the resources that are just waiting for people to harness and use to make this space a better place. So my question, most of you have gone on the website. My question is, how do you see yourself? How do you see GCSCORED making an impact? Do you know somebody who may be able to either use our service or contribute to our services so that Grenada, again, so that we can renew minds, transform lives, and create safer communities? So let me hear from others. We have 10 minutes, and I want to hear from the individuals in this group. I want to hear from Anna. I want to hear from Lindy, Nikita, Edwin, Keelan, Gracelyn, Jody. I want to hear from you guys.
Hello.
Okay, where I am is a little bit noisy because I had to move. I was on work when the meeting started. And so I'm going to be very brief. I was able to use the program within my family. I had a member of my family that had 2 mental breakdowns in the space of maybe 3 months. And I was able to use the program to find out from her what is it that is really causing the problem. With the help of Dr. Laria, what is it that she really wants for her future? What can make things better for her? And it was a really wonderful experience, although it's still a work in progress, but I really enjoyed doing that.
Okay, good. So you've seen real time benefits to being trained as a wellness champion.
Yes, I am.
Yeah. Thank you, Jody. Anybody else? Keelan, I know you said you are in social work, so tell us about that a little bit. I think I saw Edwin putting on his mic. Go ahead, Edwin.
Right. So, pardon me, but I'm driving as we speak. I'm not letting this distract me. But I think as a guidance counselor in the school system, that this program could offer a lot for the guidance counselors and the students who we work with in the school system. So I think there's a lot of avenue for using the training and the program in the school system in Grenada.
Okay, good. And so one of the things that I would want is for us to make sure we have I think we have everybody's contact information, but to just also, let's continue to brainstorm and see how we can make our aspirations a reality. All right. Thank you. Keelan?
Yes, good afternoon to everyone again. I must say it's a pleasure to be here and to share in a place where I know that persons are actually interested in what I have to say, and we share commonalities in terms of wanting to empower Grenadians so that they can improve their lives, and not just their lives, but the lives of persons around them. And when I think of empowerment, I think of it on a spectrum. And I think an issue we have in Grenada, that's my personal view, is that we need to empower the self-proclaimed empowered. So there are some persons who are serving in certain positions and they claim that they're empowered, but we need to revitalize them. We need to revitalize them, because I think social work in Grenada is a bit stagnant and it needs some energy and some enthusiasm. And when I look around at different statutory boards and so on, there are some elderly persons there and they are blocking the progress and blocking the voice of the young persons coming up. So I decided to get involved in social work so that I can be an activist, a real, true, empowered activist, where I can bring about change and help improve other young persons' lives. So I think in empowering, we have to consider empowering the young persons, yes, and also trying to empower those at the top. Empower them in a sense that we could revitalize them, or empower them where they can say, okay, I am confident now that I can let a young person come up and do something. Yeah, so I think empowerment should be general for the young persons, for the community, but also it should, of course, be for those board members, those elderly folks, those directors, and so on. So I think the GCSCORED should definitely look into that. And that's basically my contribution.
Thank you. Keelan, thank you. Kalisha Purcell Charles, I think you can speak on that as you are an active member of the Grenada Social Work. I think you were the president.
Yes, Keelan. I recently resigned from being the president of the GAPSWA, which is the Grenada Association of Professional Social Workers. However, it's still an active organization. I encourage you to reach out to the new president, Ms. Ann Greaves, and get involved in working with them. It's definitely, social work in Grenada, definitely it is stagnant. It needs movement. We need policies, we need legislation. We need to really move with social work in Grenada and start really implementing, evidence-based programs. We need to, move into looking at bachelor's and master's program and really educating persons to move forward in the helping process. It is overwhelming and it is frustrating with the limited resources. But I think that somebody has to start, and or I should say some persons have started like myself, but we definitely encourage persons, young persons like you, that have a vision for advocacy to continue your goal and your vision for helping. And I think that GCSCORED Eastern Caribbean is definitely a place to help you start in terms of transforming lives and creating safer communities and making a difference.
Thank you, thank you. All right, anybody else? We have two more minutes. How do you see this organization making a difference in your sphere of influence?
Hi, good night. Sorry, I'm driving home, but I'm listening. I definitely agree with the previous person, the young guy. As a social worker in Grenada, I think we need advocacy. There isn't much of it. But in Grenada, it tends to be a wellness society and not advocacy. So I think that is something that we need to implement, or at least enforce stronger advocacy. So I see this group, this GSCORE, helping a lot. Being a part of it will probably raise the awareness of the social ills that our persons are going through and how we can combat the problem.
Thank you. So you're a social worker as well, Nikita?
Yes, I am.
Oh, okay. Okay. All right. Well, let's make sure we have your contact information so that we can collaborate. Again, our goal is to renew minds, transform lives, and create safer communities. And we can't do that on our own. GCSCORED Grenada has to and is committed to working with Grenadians so that they can experience the transformation that we need. All right, if no one else has any other comments, I want to thank each and every one of you for coming this evening, and you are going to continue to hear from us as we move forward and try to infiltrate the Grenadian community so that we can renew minds, transform lives, and create safer communities. So I wish you all well and stay in touch. I will send a follow-up email with next steps on how we can continue working together. All right? Well, thank you all for coming and see you soon. Take care, everyone.
Good night, everyone.
Bye.
Good night, everyone.
Good night.
Bye-bye.
Good night.
Good night. Good night.